would like to start with a disclaimer. I'm actually much older than I look. So please, don't be deceived by the height and the voice. But just a question before I start. How many of us use AI on a daily basis? Okay, now I'm starting to see the young people in the room shining, so big ups. Okay, so good afternoon, everyone. My name is Vhugala Ngwenya, Project Coordinator at Shout It Now, South Africa. Today, I'll be presenting work that is a collaboration between the University of Cape Town and Shout It Now on an AI tool called Self-Cav, which is an AI-powered chatbot that was co-designed with adolescent girls and young women to support sexual health and well-being. Okay, so across South Africa, over 1 million young people struggle to access information that is safe and non-judgmental, especially when it has to do with health support. And this leaves a lot of young people without the guidance they need to make informed decisions about their health and their well-being. So what is Self-Cav? In South African slang, Self-Cav directly translates to self-awareness. It's one solution that we've explored. This tool is housed on WhatsApp, and it was designed to provide young people with safe, private, and relatable space where they're able to explore their health. One thing that sets this tool apart is it has 3 personas when you go into it. It has a best girlfriend, a best guy friend, and a health buddy. And this allows young people to interact with a persona that they feel comfortable with the most. It was developed with our technology partner called Order, and it was developed for the National Department of Health. And it is integrated into the BeWise platform, which is a national digital health platform that provides information that is relatable to young people. It provides them with resources as well as the option of accessing online referrals. This project was funded by SAMREC, which is the South African Medical Research Committee, as well as the UGood research program. And like I mentioned, we're collaborating with our partner, the University of Cape Town's Accelerate Hub. Oh, I didn't realize I've been moving my slides. Technology. Okay. Let's move on to the research, to the study design. This is a qualitative study that is part of a larger mixed methods project, and we conducted 3 focus groups with 27 adolescent girls and young women across 2 provinces. And this was in urban areas, peri-urban areas, as well as rural areas. And this was collected in June to July of 2025. We explored with participants their experiences on AI, the acceptability and safety of Self-Cav, as well as relational well-being and future research interests. The data was analyzed collaboratively using reflexive thematic analysis with a platform called Deduce, and this was supervised by senior researchers. Let's move on to the findings. So we picked up that participants expressed both excitement and usefulness when it comes to Self-Cav. They also expressed frustration when the responses felt not so personal. For example, one participant said, "I also picked up that it uses a lot of slang, so yeah, I like that about it. It has to be relatable." There were other participants that highlighted ambivalence when it comes to AI. One participant stating, what I realize is that it actually takes away our ability to think independently. We have become so lazy, to think on our own. These codes really show us that as much as the young people appreciated this technology and AI and its relatability, they were also critical about how AI influences their own thinking. We found that when it comes to Self-Cav or AI in general, safety was a major concern. Participants recommended that it should have direct links to safeguarding services for when they feel at risk. For example, one participant said, "I think they also must have a way of alerting SAPS, which is the South African Police Services, maybe when you are in danger." They also raised concerns about the storage of their data, one participant stating, "How do we know that this thing is not keeping evidence of us, even if it says that the chats are deleted?" And participants also wanted some level of guarantee that it is a safe space for them to share sensitive information, which I think a lot of us could relate from the previous activity where we were being asked questions on AI, and some of us had our own reservations, especially when it comes to health information. So these concerns were raised a lot throughout our research findings. We've also found that there is some level of unmet expectations and false choice. So some participants noted that as much as Self-Cav is informative, it lacked empathy like a human would. For example, what I noticed is, okay, it is informative, right? But the answers are just simple. It's nothing deep, So there was also a lot of confusion with other tools, making acceptability harder to judge. I thought Self-Cav was Amy. Amy is another self-care tool that we have as Shouted Now, which is very similar to Self-Cav. I thought Self-Cav was Amy, so I guess I didn't think it was different. So this shows us that for young women, there's important things that we need to consider. One being context, the tone, and clarity when it comes to AI engagement. So overall, the acceptability of Self-Cav depended on the perceived safety of the users, the transparency, as well as the usefulness of the referrals. Participants did highlight areas of improvement, which included personalization of the personas and the tone, ensuring that it is safe and trustworthy, and clearer differentiation from other similar tools. And these findings will guide training of future digital platforms, evaluation, and the scaling up of Self-Cav. And this will also assist us in shaping future research. And lastly, I would like to thank the adolescent girls and young women who participated in this study, as well as our funders and our collaborative partners. Thank you.